Today I'm going to talk about a very serious topic: stroke. Stroke is a medical emergency that occurs when the blood supply to a part of the brain is interrupted, causing brain cells to die. Stroke can lead to permanent disability or death, so it's important to recognize the warning signs and act fast. According to the World Health Organization, stroke is the second leading cause of death and the third leading cause of disability worldwide. However, many people are unaware of the risk factors and symptoms of stroke and may miss the opportunity to prevent or treat it. In fact, some studies suggest that up to 40% of strokes are preceded by transient ischemic attacks, or mini-strokes, that can occur up to a month before the actual stroke. A transient ischemic attack, or TIA, is a temporary blockage of blood flow to the brain that causes stroke-like symptoms, but usually lasts only a few minutes and does not cause permanent damage. However, a TIA is a warning sign that a major stroke may happen soon, and should not be ignored. In this video, I'm going to share with you 10 warning signs of stroke that may occur 1 month before, and what you should do if you experience them. Number 1. High blood pressure. High blood pressure, or hypertension, is one of the most common and modifiable risk factors for stroke. High blood pressure damages the walls of the arteries, making them more prone to rupture or clog. A normal blood pressure is below 120/80 mmHg, while a high blood pressure is above 140/90 mmHg. If you have high blood pressure, you should monitor it regularly and take medication as prescribed by your doctor. You should also adopt a healthy lifestyle, such as eating a balanced diet, reducing salt intake, exercising regularly, quitting smoking, and limiting alcohol consumption. Number 2. Fatigue. Fatigue is a feeling of extreme tiredness or exhaustion that does not go away with rest. Fatigue can be caused by many factors, such as stress, lack of sleep, infection, or chronic disease. However, fatigue can also be a sign of reduced blood flow to the brain, which can indicate a TIA or a stroke. If you feel unusually fatigued for no apparent reason, especially if you have other stroke symptoms, you should seek medical attention as soon as possible. Number 3. Vision problems. Vision problems, such as blurred vision, double vision, or loss of vision in one or both eyes, can be a sign of a stroke or a TIA. This is because the blood vessels that supply the eyes and the brain are connected, and a blockage or a bleed in one of them can affect the other. Vision problems can also be caused by other conditions, such as migraine, glaucoma, or eye infection. So it's important to consult an eye doctor if you have any changes in your vision. However, if your vision problems are sudden, severe, or accompanied by other stroke symptoms, you should call an ambulance immediately. Number 4. Sudden headaches. Headaches are very common and can have many causes, such as stress, dehydration, sinus infection, or migraine. However, a sudden, severe, or unusual headache can be a sign of a stroke or a TIA, especially if it occurs with other stroke symptoms, such as weakness, numbness, or difficulty speaking. A stroke-related headache is often described as the worst headache of your life, and may be accompanied by nausea, vomiting, or dizziness. If you have a headache like this, you should not take any painkillers or wait for it to go away, but seek emergency medical help right away. Number 5. Numbness or weakness on limbs. Numbness or weakness on one side of the body, or in one arm or leg, is one of the most common and recognizable signs of a stroke or a TIA. This is because a stroke affects the part of the brain that controls movement and sensation, and the symptoms usually occur on the opposite side of the body from where the stroke occurred. For example, if the stroke occurred in the left side of the brain, the right side of the body will be affected, and vice versa. Numbness or weakness can also affect the face, causing drooping of the mouth or eyelid, or difficulty smiling. If you notice any numbness or weakness on one side of your body, you should try to raise both arms above your head, and see if one arm drifts downward. Number 6. Difficulty speaking. Difficulty speaking, or dysarthria, is another common sign of a stroke or a TIA. This is because a stroke affects the part of the brain that controls speech and language, and can cause slurred speech, slow speech, or loss of speech. It can also affect the ability to understand what others are saying, or to express oneself clearly. If you have difficulty speaking, you should try to repeat a simple sentence, such as "the sky is blue," and see if you can say it correctly. Number 7. Memory problems. Memory problems, such as confusion, forgetfulness, or disorientation, can be a sign of a stroke or a TIA. This is because a stroke affects the part of the brain that stores and retrieves information, and can cause short-term or long-term memory loss. Memory problems can also affect the ability to recognize familiar people, places, or objects, or to follow simple instructions. If you have memory problems, you should try to remember your name, address, and phone number, and see if you can recall them correctly. Number 8. Loss of balance. Loss of balance, or ataxia, is a sign of a stroke or a TIA that affects the part of the brain that coordinates movement and posture. Loss of balance can cause dizziness, vertigo, or difficulty walking or standing. It can also affect the ability to perform fine motor skills, such as writing, buttoning, or tying. If you have loss of balance, you should try to walk a straight line, and see if you can do it without stumbling or falling. Number 9. Nausea and vomiting. Nausea and vomiting are not very common signs of a stroke or a TIA, but they can occur in some cases. Especially if the stroke affects the part of the brain that controls the digestive system or the vestibular system. The vestibular system is responsible for maintaining balance and spatial orientation, and a stroke in this area can cause nausea, vomiting, or motion sickness. Nausea and vomiting can also be caused by other conditions, such as food poisoning, stomach flu, or pregnancy, so it's important to rule out other possible causes. However, if your nausea and vomiting are sudden, severe, or accompanied by other stroke symptoms, consult with a healthcare professional immediately. Number 10. Chest pain. Chest pain is not a direct sign of a stroke or a TIA, but it can be a sign of a heart attack, which is a major risk factor for stroke. A heart attack occurs when the blood supply to the heart muscle is interrupted, causing damage or death of the heart cells. A heart attack can cause chest pain that feels like a pressure, squeezing, or tightness in the center of the chest, that may radiate to the arm, neck, jaw, or back. A heart attack can also cause shortness of breath, sweating, nausea, or lightheadedness. If you have chest pain or any of these symptoms, consult with a healthcare professional immediately, as a heart attack can lead to a stroke or cardiac arrest. These are the 10 warning signs of stroke that may occur 1 month before. If you experience any of these symptoms, you should not ignore them or delay seeking medical help, as they could indicate a serious condition that requires immediate treatment. Remember, stroke is a medical emergency, and every minute counts. The sooner you get to the hospital, the better your chances of survival and recovery. I hope you found this video informative and helpful. If you did, please give it a thumbs up and share it with your friends and family. Also, Don't forget to subscribe to my channel and hit the bell icon to get notified of my new videos. Thank you for watching, and I'll see you in the next one. Stay healthy and safe.